going back to needing a mentor as a resident, we find ourselves in spaces that we are not understood. We're immediately, as Black people, assumed to be of lower intelligence. Before we even open our mouth, before we even fill out an examination, we're assumed to have been the recipients of affirmative action. And we're assumed to not be hard workers. Where do people get these biases from? I don't know, but it exists. So the moment you walk in there, you are fighting against bias in their minds. I'm not just talking about your patients, I'm talking about your other residents, your other doctors, I'm talking about your attendings. So many times, if you can, it's important that you find an ally in those spaces, someone who knows how that institution works, somebody who is a resident, somebody who is an attending or a professor, someone you can go to. They do not have to be in your department, they don't have to be in your field, and they don't even have to be within that hospital system. If they're within that hospital system, that is even better for you. But it's very critical that you find a mentor, because you will be faced with such situations where you're being accused of something you have not done, or you're being threatened with expulsion, or there's a misunderstanding about your behavior perhaps, and you need to clear your name. And you find that having a mentor will help you on how best to navigate that space. And I have been there as a resident. I know the feeling. You are at the mercy, because until you graduate with that degree, even 1 year before you complete your degree, you can be cut. You can be cut. You say something out of character to somebody in the program, they get what shall I say, they catch feelings, they get angry, they put something bad in your review, you're called before committee to answer for yourself. It's just a wide range of possibilities of what may transpire, but when you have a mentor, it really helps for you to navigate that space. And that's why, if you're thinking of applying into medicine, if you're a medical student, if you're a resident, continue. We need you in that space. We need you to become a professor. We need you to become a department head. We need you to be an assistant clinical instructor at whatever institution you are, because your presence will make it easier for those behind you to walk through those hallways. Thank you for listening.